Thank you so much, Dr. Shireen, for Dr. Rasha for the nice introduction. I'd like to thank Professor Ines for telling me to participate in this exceptional event and to be from the work group which worked over among very eminent professors working on the prevention work group. I'll try to be very rapid with my lecture because it has a lot of topics. Media types, maybe we know about the print and the broadcast types. Still, they are not outdated. They are still in use, especially by the healthcare authorities and the governments for spreading major mass health ideas and messages, as we can recall from the COVID era. They may fit more the extremes or the unprivileged areas and even those who are not internet users. Regarding the social media comprises a lot of internet-based communication platforms, and now it had gained over the last 2 decades, had gained a lot of popularity, and almost up to, according to the latest statistics, in April 2024, most of the users daily use social media more than 150 minutes, and even in least developed countries, as mentioned by the UN, as in this this is from the UN nations. The UN nations govern classification of countries, the low income countries, least developed countries, who have least use of internet. There had been an access to social media with an average increase from 17.6 to 35 from the years 2018 to 2023. And as of February 2025, almost 4 months only ago, it has been shown clearly that all over the world, 5.5 billion people use the internet, and out of these, 5.2 billion people use social media. And here comes the concept of how all those people are using the social media. How can we make use of this? Global internet usage is highest among the age groups from 15 to 24, which is constitute part of the youth age group we are concerned with in the prevention. Though most usage of this age group in Europe and high income countries, yet according to the distribution, even in Africa, though it is less than 60% of internet users, still more than 2/3 of the internet users in Africa are from the youngest age group, from the 15 to 24 years, and the other third is for the older ones from 24. And here comes the efficacy of using this social media into a framework which can be used into obesity prevention and even management by gaining some social cognitive theory concepts and social modeling, observational learning, and verbal persuasion. This can use the online social media features, the networking, the data sharing, and the peer grouping and communication to go through the behavioral change techniques. People can have feedback on their behavior, how they can decrease their weight, and they can have support from peer groups and others who can help them problem solve solve problems which came across their acts to decrease their weight. It helps them to go into determinants of the behavioral change as a social support and the positive outcomes. البيهيفيرال change ده بيتلخص في 4 حاجات: increased physical activity, increased energy expenditure, healthy eating, and decreased dietary intake. For the health outcomes هيبقى في عندنا decrease في anthropometric measures على مستوى waist circumference, body mass index, and body weight decrease, as long as it increased physical activity. Social media other benefits goes for the holistic approach, not only for the young age groups, but only the whole family can be engaged in the online activities, as well as the gaining of the easy access to health information, videos, stories, and cookery classes, and mindful eating, sharing tips. And users, especially the youth age group, can find inspiration, motivation, and role modeling from celebrities, influencers, and Nobel Prize winners, for example, and even success stories from those who use those social media applications and lost their weight. Regarding the technology tools and the artificial intelligence, as you heard in the lecture of Peter Schwartz, there is a task force for diabetes and AI now. AI, there is machine learning. Now we can الهيلث ريكوردز الالكترونيك هيلث ريكوردز، وفي حاجات دي اللي بتستخدم في الناتشرال لانجويج بروسيسنج وي يوز افري داي. في حاجات تانية زي الانفورسمنت ليرنينج اللي هي بتبقى في الام هيلث، والتراكتورز الحاجات اللي هي تراكتبلز هنتكلم عليها دلوقتي. الديب ليرنينج اللي بتنفولف بقى الجيناتيك اناليسيز في ال prediction of prevention of obesity according to genes. الموبايل health applications والwearable health technologies in كانت rings or watches or whatever activity track wristbands حقيقة فيها promise قوي جدا, and now it's gaining more popularity in personalizing obesity management by giving the counts, for example, for the walks, and promote weight reduction. It increases the weight activity and give prompts for those who use it. A meta-analysis of 12 studies as per this published in 2022. A meta-analysis of 12 studies evaluating the mobile apps interventions had showed that there had been reduction by at least 1 kilogram for the users, and this highlight the potential use of mobile technology to complement the traditional care approaches. According to these studies, as had been mentioned earlier, it can't be solely an AI application. It should be monitored by a healthcare physician or a coach, because it should be a hybrid between a human factor and the AI factor. Artificial intelligence applications like the eating trigger or the medics had been presented by Professor Peter. These can modulate the eating behavior through features such as the chatbots or foot image recognition, and immediately calculating the calories using the computer vision and the automated nudges. This will help promoting the mindfulness and self-regulation for the user, and thus leading to decrease in overeating and snacking, and hence decrease weight gain. Regarding the machine learning, individual data like anthropometric measures, meal logs, activity, walking, swimming, whatever activity done, running, for example, and other lab results are to be entered into those applications. Those can, machine learning that will add all these data for one person to do it a personalized, tailored advice per person. It is not for all, and data-driven insights for better health decisions per one user. It is not one fits all, and engages users with real-time feedback immediately. This, for example, this meal is not suitable. For example, now you have to walk because you ate one of those up in the pyramid, nutrition pyramid, one of those sweets or something like this. It sets goal setting according to every one's activity and probabilities, and sets reminders and progress tracking as well to encourage adherence and long-term success, because not all patients or not all users, because those prevention, we are not meant with patients, we are meant with persons combating obesity. Regarding the virtual reality, which is gaining, the dynamic video games are gaining much more popularity among the young age groups, and they can use it using the wireless handheld controllers or even with wires. It can help them increase their out-of-body expenditure via gaming in front of a screen. Maybe boys go into footballing or even boxing or wrestling. Girls may go like dancing or yoga or zumba or whatever. But there had been a notice that those advancements in gaming technology, though they are increased developed in the metaverse, may lead to the next generation being more indulgent into their small locked spaces. Key message takeaways: traditional media remains essential for obesity and type 2 prevention. Social media is an underused, underestimated tool, but very effective according to trials and meta-analyses for public engagement and health education. It connects professionals and improves information access. It supports behavior change through goal-setting, feedback, and social support. However, regulations are required to ensure accurate, evidence-based health information dissemination, and this should be done via recognizable healthcare authorities or societies. AI intersects with healthcare, and it enables personalized obesity intervention, boosting efficiency, diagnosis, and accessibility. Thank you so much for this.